healthy and happy heart, and I congratulate you as one of our best MSc students in preventive cardiology at Imperial College on producing this excellent piece of work. And as we face this pandemic of COVID-19, it's important to reflect on cardiovascular disease as a whole. And I looked at the numbers today from the European Health Agency, and the number of deaths attributed to COVID-19 is now 2,236,386 worldwide. And of course, every death is a tragedy. But by comparison, in 2020, there were over 17 million deaths attributed to cardiovascular disease, the commonest cause of death worldwide. And when asked, what is the impact of COVID-19 on the heart? It is understandable that people look to the impact of the virus on the heart and circulation, and this is an inflammatory and prothrombotic disease. And it's true that patients with severe COVID-19 admitted to an intensive care unit and who succumb to this disease have evidence of myocardial damage, elevated troponin I levels, for example, by comparison with those who survive. So this virus does impact the myocardium, the heart, and the circulation directly. But actually, the impact of this virus is a great deal more profound than its effect on the myocardial tissues. And that's because at the start of this pandemic, patients who became symptomatic with chest pain and with a potential heart attack, or indeed with symptoms of a stroke, did not come to hospital. There was a dramatic reduction in attendance at hospital for patients with acute coronary syndromes and strokes. And as a consequence, many of these patients did not receive the life-saving treatments of thrombolysis, angioplasty, stenting, and so on, access to the cardioprotective medications which we prescribe our patients. And as a consequence, will have died prematurely in some cases and will be at higher risk of having a subsequent major cardiovascular event. So COVID-19, in addition to its impact on the heart directly, has a much, much greater impact on the presentation and risk associated with cardiovascular disease in the population as a whole. And that leads me to my final remark, which is that as a consequence of COVID-19 and as a consequence of patients with cardiovascular disease presenting late and with more complications, the need for preventive cardiology is even greater. And for practitioners like ourselves, for physicians, for nurses, for physiotherapists, for dietitians, for occupational therapists, pharmacists, psychologists, the whole multidisciplinary team, our services are required even more now than they were before. And your book, which addresses weight loss and type 2 diabetes and stress management, is an important contribution to the work that we all now have to do. Thank you very much, Pranita.
Thank you very much, Professor Wood, for this overview. And just a question to you. Would it be sound to say or wise to say that people with this cardiometabolic condition, as long as they work to reduce those risk factor by adopting healthy mindset as well as positive lifestyle. They would reduce not only the risk for cardiovascular diseases, but subsequent COVID-19 and other infective diseases as well.
Yes, that is absolutely true, that patients infected with COVID-19 have a higher risk of dying, despite all of the treatments which are now being used, if they are older, if they are overweight or obese, if they have diabetes, high blood pressure. In other words, if they have comorbidities which underpin cardiovascular disease, puts them at higher risk of dying from COVID-19 itself. So if we were all to follow the examples in your book, it not only lowers our risk of cardiovascular disease, but it also lowers our risk of dying from intercurrent infections like COVID-19.
Fantastic. Thank you very much. And for everyone, Professor Wood is living and breathing example of a person who not only lives joyfully, but lives purposefully and contribute to everyone with his unique skills and talent, just like what I say. Thank you so much for joining me and others here. Thank you.
A pleasure, Pranita.
So that brings us to
You muted yourself.
thank you. Welcome, Mr. Kolvekar. Just a brief introduction about Mr. Kolvekar is he is a consultant cardiothoracic surgery at Bart's Heart Hospital, and he wears many other hats and do charitable contribution to across the world, and has, although in a reactive medicine, a professional who works in a reactive medicine, he also has a preventive approach and is promotes his message of secondary prevention for his patients after the heart surgery. So it's over to you, Mr. Kolvekar. Would you like to share a few words?
Let me do that. I hope you can see. They're just slide for distraction so that people should not look at me. It's just a small topic. I think we shouldn't forget that today we are celebrating Pranita's achievement. I've been working with her regarding the preventive cardiology for some time since I know her. She's been good advocate of a healthy lifestyle. And before COVID, she used to promote a one-to-one to remote consultation with it. And I think she's done a good job creating a book, and I recommend that. I already started recommending to my patients because I do something drastic. I'm at the end user for people who have not been good with their lifestyle, or some other unfortunate reason they develop a cardiovascular problem. After they're dealt with by Professor Wood, they come to me for a final thing to help them. And I think that's, and I just want to share, I did do some preventive stuff. In 2010, I was almost like targeted for my issues with butter. I worked with a saturated fat sort of problems, and there was a group called Sat Fat Nation. I didn't realize when I was promoting it that it was also funded by Unilever. But there was a guideline about the fat, saturated fat, and I did a big promotion saying, stuff, you should ban a butter. The whole message was to reduce the butter, but people took it literally. And I was almost for 1 week, I was in the media, either on a newspaper or a television. And it wasn't pretty because people thought I'm after their butter. But I still feel saturated fats are not exactly good. Anything in moderation is fine, but if you have too much of it, could cause a problem. This is what I do. You see on the top side here is the bypass graft. I put the blue markers just for seeing it's just sort of prevents it twisting. These are the bypass graft taken out from the leg. This is heart. See how much fat heart has. This is a scar in the midline. I split up the sternum, so I'm not exactly minimal invasive on this aspect. In the past, we used to have a scars on the legs that big, but now we do through the keyhole. So that's my job, and that's what I do. And after, you can imagine, after going through some major surgery, patient have several issues. I won't talk about today about the past, but now after the operation, they go into different phases. So people have several issues like post-operatively. They feel fear about recovery, issues, do's and don'ts, pain issues, medications, side effect of medications, sleep, missing work, fear of happening. Most of my patients feel the fear of happening it again. Any little ache, they think they're getting a heart attack. Any little palpitation, they think they're going to collapse. And the biggest fear, especially men, are more suffering with this than the women. So they worry about the family. It's a sort of a traditional the way they behave, about the children, and it sort of all muddled together, which, and then this is what they have issues with it. So I think uh, this is what I took from a book of Pranit. I read it. It was amazing book, and it was very, very helpful. And I already recommend it to my patients because I get asked questions. What do I do? What shall I eat? What else? See, it's easy for me to say, go have a healthy lifestyle, or don't stress yourself, just be chill. These words mean nothing to that patient because he's suffering. For him to give him some sort of a points, and I agree with Pranita in her book about this, having a positive mindset, lifestyle. She will talk about it more, but I just copied from her book. And this is about the stress issues. These are the tips we tell, but I think the book will help them. And often it's very helpful to them to know about. But we give them a booklet telling what to do, but it's not enough for them. This is the best sentence I liked from Pranita's book. You're right. You say your blueprint gene, and some people give up. Like my father had it, my brother had it, and my days are numbered. But Pranita is right. Even though you're a genetic blueprint, but you could change it from a right mindset, right food. As our mom used to say, you are what you eat. And that's how she forced her to eat things, because she thought if you have a lamb or other meat, you'll be tougher. So we used to eat meat. And that's how mother managed to get us food. Same way, you are what you eat, and you can change your blueprint. And that's what one of the best message I got it from the book. And lastly, I congratulate Pranita for a lovely book. It's very useful, and it's going to go to my patients' recommendations so they can have it. My suggestion to Pranita is that she should communicate with British Heart Foundations and send them some link, because that's one of the biggest website accessed by all the patients before and after surgery, after cardiac episodes. And now I live, I think I congratulate her for achievement, and I think if you have any questions, I can answer. But I think I'll let Pranita talk about her book and also any other discussion points. Thank you.
Thank you very much, Dr. Kolvekar, for that very visual description of what you do and what your patient do, especially what they go through in their mindset, their emotions after the surgery. We often feel that, the patient often feel after the surgery, their problems are going to get resolved like a magic wand after the perhaps surgery or the medications. But what you are saying is it's it doesn't resolve automatically unless they continue to sustain the positive lifestyle. Am I right in saying that?
Yes, you are absolutely right, because I think once you operated and they said you're going to fine, it doesn't work like that. I get always asked question. I This is a joke and nobody should take it literally. Often my patient says that after the operation, am I okay? And I'm going to be fine. I tell them this joke after the operation, not before. I said I didn't become a orthopedic surgeon because if I break your knee or a hip by a bad operation, you will come on a wheelchair and run me over. If I'm an eye surgeon and you mess it around with your eyes, you will come with a patch and beat me up. But in cardiac surgery, if I make a mistake or if I don't do the good job, they don't come back. And so if you're there and complaining, that's a good sign that everything went fine. That's just a joke initial stage, but they will need your help. Pranita, your book is amazing and that will help them. Because they're looking for something. They go to this Dr. Google and find some strange remedies and get misguided, distracted. British Heart Foundation website is good, but it's too much for them. Usually they can't focus immediately after the operation. And I think if you have something which is on a PDF or just a hard copy, it'll be great help. Thank you.
Thank you. Thank you very much. Um, Now we come to our third and final speaker of the evening, Dr. Pratiksha Gandhi. Dr. Pratiksha Gandhi,
I'm there. I'm there.
fantastic. Um, a brief introduction for everyone about Dr. Pratiksha Gandhi. She's multi-award winning preventive healthcare expert, speaker, researcher, author, and founder of India's first preventive and non-surgical cardiac care center called Institute of Preventive Cardiology. And in March 2017, she was awarded as one of the top 50 global women healthcare leaders. She lives like Professor David Wood, like Mr. Shyam Kolvekar. She lives and breathes a passion for prevention. And she has many stories of how, especially developing countries like India, needs a preventive cardiovascular control, and it should go into the each street, town, and villages. So I hand over to the expert in this field. Here you go.
Thank you, Pranita, and congratulations. My like it's really an honor and pleasure, especially being with Dr. Wood and Dr. Kolvekar and the amazing audience over here. I'm grateful for this opportunity. First and foremost, I am here because I really support the work of Pranita. Whatever she has been doing is so much very important because as everyone has stressed that cardiovascular disease is number one killer, and most of the times people come to know like once they've got heart disease. And as Dr. Kolvekar shared, that it is very much stressful for the patients to go through those surgeries. And in fact, even doctors, because I'm sure Dr. Kolvekar will agree with me, when they do those surgeries and they are stopping the heart of the patient. Somewhere they are also undergoing a lot of things in their mind, because even though everyone is expert, because you want to save the lives of the patients, so the whole story is that why we wait for heart attack to happen, because 70% of the people get heart attack as first symptom. So this whole book is about prevention, that if everyone starts taking these measures, then hopefully we will be able to reduce the incidence of heart attack and heart disease. And I really agree, and I'm so happy when I heard when Dr. Kolvekar told about approaching the British Heart Foundation, and he being a resource person, that really shows the large-heartedness from a cardiac surgeon, because most of the times the cardiac surgeons are so busy that they really don't have time to support such activities. But it's really great of him. And especially Dr. David Wood has been such an inspiration to Pranita, because Pranita was not actually what she is today. She had her own challenges, which she has written in the book. Even I had my own challenges. I got graduated from the allopathic mainstream medicine, and I was a hospital owner. So my story back in India was very different. Like one of the patients came to me. In India, there is nothing like what you have NHS. People have to spend on their own. One patient literally cried and told me that I don't have money for a surgery, and it is better to die because I am retired, and in my meager savings of which actually comes to $2,000, I have to live my whole life. And somewhere I felt so disturbed that whatever like I had studied and my academic distinctions, everything failed, because I was in front of this person, and I was also brought up in an economically challenged family. So I understood that what it means. And then I was doing a research with the Yoga Institute in Mumbai, India, on reversing heart disease. So at that point of time, I'm talking in around 1997, there was this Dr. Dean Ornish's Reversing Heart Disease book, which was very, very popular. And now too, he has written a new edition, Undo It. So it's like what Pranita is doing is little very different. She has given a DIY, but I'm just giving you a reference that there are a lot of doctors in the world who have focused on preventive cardiology. So I was doing this research where we proved with angiography before and after that blockages could be reversed. And this became actually my ray of hope, where with this patient, I started doing diet, exercise, yoga, and within 6 months, his treadmill was negative and his ejection fraction moved from like 45% to 60%, and it was amazing. So even Pranita has written amazing case studies, especially like the case study of Mr. Sun, how he improved and how she has helped. She has helped plenty of her patients. She's very hands-on, and what I liked in her book was that she has given this complete combination, which is generally not available. There will be books on diet, there will be books on exercise, and there will be books on different topics. But what she has done is that I like the self-assessment what she has given. So she has given, I would say, a practical DIY, that is do it yourself, because many patients they just want to know about lifestyle, but they are not actually ready to go to a person. I would always recommend that it is always best to go to an expert to do it. Like Dr. Kolvekar rightly said, they go to Mr. Google, they just go and search something and they try to do by yourself and mess up most of the times. So it's always best to go to an expert. And Pranita has been with the best, Dr. Woods, who has done amazing work. So she is highly trained, qualified to guide. And what I also liked about her book was she has written like affirmations, beliefs. She has brought in this mind body connection, which I feel is so relevant, because most of the times when the patients have done like a surgery or angioplasty or taking medications, they are not focusing on the root cause of the ailments. And Pranita has brought up very well the importance of sleep, the importance of a happy mind, the importance of the releasing the negative emotions. And not only that, she has given practical tools to do that, because there are many books we just talk about it, but here she has given a lot of self-help tips and practical tips to do it. Not only that, she has also given links to the videos to her website so that you can actually listen to those visualizations and do it. uh, Most important is, I will just give you one story of the power of visualization. The research which was done, they took two group of people. One group of people actually played the piano, and they put their fingers on the keyboard, and another group mentally visualized that they will be they are playing those keyboard with the fingers. And then they did the brain scans, and then they found out that the people who were actually visualizing those with the fingers, they had same changes as the people who were really doing it. So dear friends, what I want to drive home the point is that when you visualize that you're having a wonderful health, you're healthy, like Dr. Kolvekar so rightly said, that all the fears which patients are facing is, will I get it again? I really connect with him on this point, because I'm also like running programs on preventive and non-invasive cardiology. As I told you that I help the section of people who wish to avoid open heart surgeries. I am a pioneer and expert in EECP therapy. I have written research papers on that. Uh, so basically, what I am doing in my practice is, basically I'm helping people in the same way along with ECP therapy. So I feel that whatever therapy do, whether we do surgical or non-surgical, whatever it is, what Pranita talking is a cornerstone, the cardiac rehab, the exercise. Because every time they're getting chest pain, they're fearing a heart attack. I have seen people not able to live happily. I had one story where, like, a woman came to me. Her husband was advised to open heart surgery, and she had not slept for 10 days. I said, why? She said that I'm putting my fingers on the nostrils of my husband every 1 hour and checking whether he's breathing. you know I mean, I know we find it very weird, but trust me that the pain which the patient goes through, the family goes through after one becomes a heart patient, the doctors go through the stress, is tremendous. And we it is our moral responsibility to reduce this global burden. And I feel that Pranita has taken a bold step by writing this book. We are all in her support, and thank you everyone for coming here, for supporting her. We need more and more doctors like Pranita, like Dr. Woods, like Dr. Kolvekar. It's a teamwork. Everyone is required. We require surgeons, we require preventive people, because everyone has to work hand in hand in collaboration to help the patients live a better quality of life. So thank you very much. I want all of you to go ahead and read the book and start doing what Pranita says. And Pranita, again, once again, you have done wonderful. Thank you so much for having me here. It's really a honor and pleasure to be with all you great people out here. Thank you.
Thank you. What a generous explanation from experienced professional, a clinician, and someone who is in the field, and seeing the people and seeing their sorrows and tears. So I would really be, because I know Professor Wood um, has worked in different nation, and he also has the experience of working in WHO World Heart Foundation as well. So Professor Wood, if I may ask you, have you come across this kind of experiences where people uh, uh, we are very fortunate in UK to have NHS, which is the care has been provided by government. But in the developing countries and some other countries where the care, the hospital charges uh, are too beyond person's pocket and family. How did you have any experience where people came to you and spoke about their distress regarding it? Unmute. You may need to unmute. Yeah.
Yes, you are right. There is great inequity in the world, both in terms of the acute treatment of heart attacks and strokes, and also in prevention and rehabilitation. And the focus of governments tends to be on the sick and the need to provide acute medical facilities, interventional cardiology and cardiac surgery. And of course, all of that is necessary, very necessary. But preventive cardiology becomes something of a Cinderella to these acute services. And access to preventive cardiology services is much more limited, even